So welcome everyone. It's such a pleasure for Angela and myself to be able to spend time with you this evening to help prepare you for your nursing exams. Now on this first slide, briefly, let's just look at how our time with you this evening will progress. And we also want to share with you the dates for 2 additional upcoming webinars. So this evening, we're going to review some important points about the NCLEX exam, what it is and why it is important now, the spectacular 7 SMART study habits. We'll talk about nursing exams and how they are different from other exams, what you can expect, and how to prepare for them. And we're going to talk about some of the top test-taking strategies, and we'll practice some test questions, as Jenna said, and show you how to use clinical judgment skills and test-taking strategies to answer the questions correctly. And then we'll talk about the evolved site and alternate item types. And Angela is going to demonstrate how to best locate questions that relate to the content that you're being tested on. And some important future dates that we just want to share with you. September 22nd, we're having a session that is a review for the NCLEX-RN. And although the session is planned for junior and senior students, we welcome everyone to join us. We will be presenting many practice test questions, and the session will be very beneficial. And then on October 6th, we are presenting a session on how to master pharmacology and answer these types of questions. So we would say that this is definitely going to be a helpful session for you. Okay, on the next slide, the NCLEX examination. Well, this is the exam that you must take and pass after graduation. And your goal is to pass this exam on the first try. So you may ask, why is the NCLEX exam important now? Well, NCLEX preparation must begin the moment you enter your nursing program. And as a beginning nursing student or sophomore, you may think that the NCLEX exam is far off, and it is. However, it's critical that you think about it the moment you enter your nursing program. Oftentimes, students are concerned with the here and now of what they want and need to accomplish. And they're not concerned about the future, which is the NCLEX exam. And some students even tell us, I will worry about the NCLEX exam when the time comes. And at that point, it is much too late. So you must think about this exam early on. Now, your nursing curriculum is designed to prepare you to pass the NCLEX and be a competent and safe professional nurse. And every nursing exam that you take throughout your nursing program is assessing your knowledge, but it's also preparing you for the NCLEX at the same time. So it is critical that you listen closely to your nursing faculty and implement what they recommend. They're very familiar with what you have to learn to pass the NCLEX and to become that competent and safe nurse. So listen to everything they have to say. So what is important? Well, your nursing courses, your clinical experiences, reading and other assignments and activities, and any standardized exams that are required to be taken during your nursing program will also prepare you for the NCLEX. Now, you may be administered standardized exams at the end of each nursing course, and these tests are administered to assess your knowledge of the content that you've learned in that nursing course. And another valuable purpose of the standardized test is that it provides a detailed report of your strengths and weaknesses and content areas that you need to improve on. So these reports will help you plan short and long-term goals and provide you with information that you need for planning for the NCLEX exam. So take these standardized exams very seriously and prepare for them. They become your personalized and individualized study guides for future nursing courses and the NCLEX. So now effective study skills. Well, effective study skills develop from SMART study habits. Now, you may already have some effective SMART study skills in place that you developed in your prerequisite nursing courses, like your A&P, chemistry, microbiology. And if you do have good study skills in place and these worked for you, then continue with these study skills during your nursing education. So remember that everyone is different, and what may work for someone else may not work for you. So it's important to know what's going to work for you to be successful. So now on this next slide, we're going to talk a bit about the spectacular 7 SMART study habits, and I'm going to turn this over to Angela.
Thank you so much. Welcome, everybody. I'm very excited to talk to you this evening about how to prepare for your nursing exams and how to begin preparing for NCLEX early on, as Linda was mentioning. The first SMART study habit is to develop critical thinking and clinical judgment skills. Now, you'll probably say to yourself, what do you mean by that? What is critical thinking? What's clinical judgment skills? This is probably all new language for you. These skills involve an intellectual process of actively analyzing information. And it's essential that you develop good critical thinking and clinical judgment skills because you'll be making very important decisions in the clinical setting when you care for your patients or for your clients. And so while you're in clinical during nursing school and as you're working as a nurse, you'll gather information that you'll need to analyze, synthesize, and then apply. You'll have to make clinical judgments and decisions, and you'll have to evaluate the outcomes of your interventions. So what can you do to develop these skills? Critical thinking and clinical judgment skills actually take time to develop, but if you're mindful of the fact that you need to develop these skills, then you can set some goals for yourself regarding becoming a critical thinker. Your nursing instructors will soon be introducing you to a clinical judgment model that will help you to develop these skills, and it's really important that you're mindful of that model and that you use it, and you can use that in answering test questions as well. Another strategy is to be curious all the time and to try to think like a nurse. You want to consistently ask yourself questions as you're reading through nursing content and reflect on the information that you're reading. You can write questions down in your notebook or on your computer, bring questions up in class for discussion. The discussion will generate critical thinking among your classmates and with your instructors. Another strategy is to learn content from an analytical perspective. In other words, be creative in the way that you're thinking and be dynamic and open-minded. Look at a collection of information that you're learning, and instead of simply learning the facts, think about the information in more of an investigative manner, and you really want to cultivate that spirit of inquiry and always be curious. So for example, if you're learning about standard precautions, which is a basic level of infection control that should be used in the care of all clients or patients all of the time in order to reduce the risk of transmission of microorganisms, you don't simply just remember that hand washing must be done before and after contact with somebody, or that gloves are worn when coming in contact with blood or body fluid excretions or secretions. What you want to do is think about this critically. You're not just remembering those as facts, but rather you're questioning why these things need to be in place and why these procedures need to be followed. Critical thinking really takes more time and energy than simply learning the facts and the content, but it is an essential part of the learning process in nursing and what you do ultimately as a nurse. And so continue to work at it, make it a habit. Remember, it's a skill that's developed over time, and just remember to always think about something critically. Moving on to the next slide, we'll look at SMART study habit number 2, which is enhance your listening skills and attend class. It is vital to your success that you become a good listener and that you enhance those skills over time. If you're going to succeed as a good listener, you must get your mind prepared before arriving to class. You have to leave daydreaming and mind chatter at home. Come to class ready to pay close attention to every word that your instructor is saying to you. This is something that you have to work at too. It's not easy to pay attention all the time. So close your eyes, take some slow, deep breaths in through your nose and out through your mouth. This brings oxygen into your body and it helps clear your mind and it helps you focus. Class attendance may not be required for all of your classes, but it is very, very important. It's okay to get notes from others, but being in class, whether it's in a classroom, virtual environment, synchronous sessions, is all really important, and it gives you the advantage of hearing the instructor firsthand, of hearing the inflections in his or her voice, and the emphasis that's placed on certain areas that you're learning. You should listen to and get to know your instructors, listen carefully for verbal indicators made by your instructors that will alert you to what may be really important to take note of for your exams. Some verbal indicators are statements that begin with the words "don't forget" or "this is definitely on the NCLEX exam." Just a couple examples there. And so again, listen to the inflection of your instructor's voice. And if he or she suddenly accents some content area, you want to take note of that. If they become more animated during part of the lecture, pay attention and take note of that as well. And finally, whatever the instructor reviews in class is worth highlighting because it will likely be on your next exam as a question. You may not always find that the content being discussed is interesting to you, but keep in mind that you'll be tested on the material, and so it will be to your advantage to listen and learn. And then always pay attention to what your instructor may provide in a handout or a study guide or something like that. If they've taken the time to write it out, then you can be pretty certain that the information will turn up on the exam as a question. All right, and then moving forward to smart study habit number 3, learning effective note-taking skills. Good note-taking is a talent. It requires practice and good listening skills. You need to take note of the significant points made by your instructor during lectures and also during any group work or discussions that your class is having. Some instructors may provide different types of handouts or other materials like case studies that can be used as guides or group discussions during lectures. Even so, this does not replace the need for you to take some notes. You should still be taking notes, even if they do give you supplementary material. Regardless of whether handout materials are provided, one important point to remember is that you'll not be able to write every word down that the instructor mentions or every word mentioned during a group discussion. And so remember that when you're taking notes, you're not writing a novel. You won't be able to write down every word, and that's okay. What you can do is develop a personal shorthand that can help you transcribe important points of a lecture or discussion. So for example, the instructor may say, the signs and symptoms include nausea, vomiting, and diarrhea. Your shorthand would read or could read S and S equals N/V/D. And that will save you a lot of time. With practice, you can develop an abbreviated note-taking style that will likely work for you. And most students find that rewriting their notes after class is another smart study habit because it clarifies and reinforces what they've read and learned in class. There's research that does show that writing and rewriting is an effective way to learn and remember material. So give this a try when your schedule permits and build it into your plan for studying. All right, and then next, the 4th smart study habit, do your reading and make the most of it. In nursing, reading involves active involvement with your textbook. There's no way around this. reading your textbook assignments before class will be extremely helpful with the note-taking process because you'll be familiar with the significant points that are going to be discussed during the class time. So then during class, you can take notes on those points, and then you'll know what these points are. If you read the assigned content before going to class, it's going to be much more familiar to you. In order to do this and to stay on schedule with this, you do need to stay on top of your reading and read every day. There is a lot of content in nursing. There's a lot of reading. So if you fall behind, it's really, really hard to catch up. Many resources now allow you to listen to the reading through audio features. And so if you're an auditory learner, this may be a good option for you, and it might allow you to multitask as well if you can listen. Another important factor is that some faculty will give unannounced quizzes or pop quizzes based on the reading. So if you read before class, you'll be much better prepared to take those quizzes. Another thing that's really helpful is to read the preface of your textbooks. Many times students skip over the preface of the textbook because they're really anxious and excited to learn the information in the book. It's understandable that you're excited to get going and to learn all about nursing, but remember that you have a lot of reading in your textbook and that you want to make the best use of your time to accomplish everything that you need to. The preface of the textbook gives you valuable information on how to best use that book. And it also provides information about the special student resources that are available to you for preparing for exams. A website such as Evolve, which we're going to show you later, that accompanies Elsevier titles may provide practice exam questions and other great resources that correlate with each chapter in your textbook. And the preface will provide you with all of that kind of top secret sort of things, resources that may be available to you that you wouldn't otherwise know about unless you read the preface. So take advantage of all of these resources to help prepare you for your exams. Reading the chapters are really important, and then following it up with practice questions so that you can apply the information is kind of like the next step in being the most prepared. And then one final point before we move on is practice questions. It's really helpful to do those specifically when you're preparing for an exam. We'll be actually going over some practice questions shortly, and we'll show you how to best seek out those questions that will contain content for the exam, specifically for the exam that you're preparing to take. We have a way for you to do that. Okay, so then the next smart study habit, number 5, develop efficient and successful reading skills. So you do want to do detailed reading. You don't want to scan or skim the content in the textbook chapter. You want to read one section at a time under each major heading. As you read, you should highlight key points. You should develop some questions that come to mind as you're reading. Write these questions down, and then look for the answers to the questions. If you can't find the answers, then plan to bring the question to class for further clarification. Key points include any information in the text that has to do with the nurse caring for the client. So for example, key points would include signs and symptoms of a disorder and then the related nursing interventions. Highlighting key points is especially helpful when it's time to review before an exam, because you can reread only what you've highlighted rather than having to go back and reread the entire chapter. And so if you do the detailed reading initially and highlight at that time, preparing for the exam when you're sitting down to study is going to be much easier and much more efficient. As you read your chapters, you do want to try to identify what you think you'll be asked on your exam based on some of the points that we talked about earlier. Note the chapter section headings, any bolded vocabulary, information in boxes, tables, and graphs located throughout the chapters in your textbook, as well as figures and pictures to help you understand the material. Those are often areas that instructors will pull questions from for their exams. So pay attention to those. And in addition to highlighting key points, you want to make margin notes for yourself to study. It's always really helpful to have a medical or nursing dictionary with you, especially when you're first starting out, or just have a way to look up medical terms when you're studying. You could also refer to the glossary in the textbook. And in addition, Evolve provides a glossary for most textbooks as well. And so when you come across a word that you've never heard of, like edema, which means swelling, you should look it up or make note of it in your notebook as a new vocabulary word. It will be like you're learning a new language. After you've read the entire chapter, review all the highlighted key points and any notes that you have made. Review any areas that seem difficult for you. It may also be helpful for you to make flashcards for any information that's difficult. You can make flashcards for the key points that you highlighted in the reading. Students usually also like to make flashcards for lab values. That tends to be very helpful. And for signs and symptoms of certain conditions like electrolyte imbalances or conditions such as hypothyroidism versus hyperthyroidism, just some more examples of what you might want to put on a flashcard. And plus, these are very convenient to carry around with you and review at break sessions or when preparing for a test. And there might be ways to create flashcards electronically as well. And so with that, I'll go ahead and turn it over to Linda, and she'll talk to you about Smart Study habit number 6.
Thank you, Angela. Okay, so our Smart Study habit number 6 is stay focused and concentrate. So studying for an exam begins the moment your course starts and you start reading your textbooks, attending class, and you start taking your notes. So always pay close attention to your course syllabus and look at upcoming test dates, reading and other assignments, and use your syllabus as a planning guide. So plan and schedule daily study sessions for yourself. And during these study sessions, read your class notes taken up to that point with a particular focus on your new notes, the notes that you took that day in class. This is an important part of preparing for an exam so that you will not be faced with cramming the night before the test. Procrastinating and waiting until the last minute to prepare for an exam are the worst things that you can do, because these place unnecessary pressure on you and set the stage for developing test anxiety. So you want to start preparing for your exam right away. Now, a guideline that you may want to use to begin scheduling your study sessions is to plan 1 hour of daily study for every 3 hours of class time. So for example, if your nursing class is scheduled for 3 hours, then plan for a 1 hour review of your notes after the class. Then 1 week before the exam, start increasing the time that you spend in your study sessions to maybe 2 hours of study for every 3 hours of class time. Now this is only a guideline to help you think about planning, and it's not a rigid rule as far as the timelines. And so they don't need to be strictly followed. The amount of time that you need to plan for your study sessions depends on the type of learner that you are and how quickly you are able to grasp the new content and material. So just remember that everyone is different when it comes to learning needs. So think about what works best for you and plan accordingly. Now you want to set some goals, so think about what you want to accomplish during each study session. Write your goals down because it will help you stay focused and concentrate. Now, if you don't reach your goal during the study session, don't become discouraged. Just look at the point where you left off and revise your goals for the next session. Now, during a reading session, and I know that this happens to all of us, so during a reading session or study session, you may find that you're having difficulty focusing and concentrating. So in other words, you read the page of a textbook, you get to the bottom of the page, and you cannot even remember what you read. This happens to everyone because of not focusing. So this is the time when you need to stop reading and take on another activity. So get up, get out of your chair, move around, and take some of those deep breaths and get that oxygen in your body and up to your brain where you really want it. You can take a walk or do some other form of exercise, and that will help clear your mind and get you back on track so that you can focus. You're going to learn what your individual concentration tolerance is and what activity helps you get back on track. So use this as a guide for planning your reading sessions. Now, if you find that after 45 minutes, your concentration level diminishes, then plan on breaks and a different activity every 45 minutes during your study session. Okay, well, what about study groups? Will a study group work for you? Well, this question is one that only you can answer. If the idea of studying in a group environment has worked for you in the past and you feel comfortable with this type of study arena, then by all means continue this way of studying. If you're the type of learner who needs to be alone to study in order to master the content, then a study group is not going to work for you. Now, some combination of alone study time and group study time may also be an option for you. So in other words, you can plan to study on your own, and once you are comfortable with the content and think you have mastered it, then join a study group to help reinforce the content. I think that study groups can be very helpful when preparing for an exam, but the study team definitely needs to be motivated and stay on track with regard to the goal of the group. Sometimes the study group can easily get off track and waste time discussing outside of study issues, what you did over the weekend, and those sorts of things. And if this happens, then the goals of the group may not be met. So be sure to join a study group that has the same goals that you have, and be sure that your study partners have personalities that are compatible with yours so that you can easily work together. Okay, on this next slide, we have Smart Study Habit 7, which is remembering content. And we just like to say a little bit about block learning versus retrieval learning. So now once you take an exam in your nursing course, remember that you need to use knowledge of that specific content through the remainder of that current nursing course and future nursing courses. So for example, let's say that you're taking a medical surgical nursing course and you learn about the respiratory system and cardiovascular system and are tested on those two systems. Then the course moves on to endocrine and gastrointestinal systems. Well, block learning is when you think to yourself that now that I've been tested on the respiratory and cardiovascular systems, I don't need to be concerned about that content any longer. Wrong. Yes, you do need to be concerned about that content. A smart study habit is to remember that retrieval learning is critical, and what that means is that you study remembering that you need to retain that knowledge and not forget about it once tested on it, because you will need to retrieve knowledge of that content from your brain for other nursing courses, future nursing courses, and of course, on the NCLEX. So what you've heard in class and when you are reading, studying, learning, be sure your focus is on retrieval learning, not block learning, knowing that you do need to retrieve knowledge. Now, each course that you take, even your prerequisite courses such as anatomy and physiology, prepare you for building your knowledge base and your critical thinking activities. So if you are unable to remember what you learned, then you will be unable to apply the information in future courses in the clinical setting or on the NCLEX exam. Now, some strategies for remembering content that we have discussed are listed here, and they include doing the required reading before coming to class, highlighting key points in your textbook as you read, rewriting class notes, reading your class notes every day, creating flashcards for the material that is difficult for you. And another strategy is completing study guides. Now, you may have study guides as additional or supplemental books that accompany your main textbook. And these could be hard copies or they could be electronic. And if you do, be sure that you use these and answer content-related questions and activities, because this will help reinforce what you're learning, and retrieving that knowledge will be easier. And as Angela mentioned, remember that the preface of your book will identify all of these available resources, so be sure to read the preface. And an additional strategy that you can use to remember content is to develop an acronym, some kind of mnemonic device, or easily remembered letters, words, or phrases for any difficult information that you come across. So for example, we have students who always have difficulty with drawing up regular and NPH insulin in the same syringe, and they tend to forget which one they're supposed to draw up first. So we tell them to think RN. And when you're mixing regular and NPH insulin in the same syringe, draw up the regular R first, followed by the NPH and pH. So remember the acronym RN when mixing both types of insulin in the same syringe. But that's the kind of thing that you can develop for yourself to help you remember these difficult things. And many times your instructor will identify ways to remember difficult information. And if they do, take note of these. But again, you can develop these on your own and with your classmates. Okay, now on this next slide, let's talk about nursing exams. So nursing exams, well, they're administered at various points throughout each nursing course. And your faculty administer these exams to you to test your knowledge of the content taught in the course, to test your ability to retrieve knowledge, and to apply concepts learned to care for clients in various situations. And they're also administered to ensure the development, as we mentioned before, of a professional nurse and a critical thinker, while at the same time preparing you for the NCLEX exam. So on this next slide, let's talk about what makes nursing exams different from other exams and what you can expect on a nursing exam. Now, when you enter your first nursing course, you need to remember that your exam experience in college up to this point has related to testing and support courses such as anatomy and physiology, microbiology, chemistry, and the like. Now, in those courses, test questions on exam have been primarily at the cognitive level of knowledge or understanding. And those support courses have required not only a great deal of reading, but also memorization in order to answer the exam questions correctly. So basically, your test-taking skills to this point may be quite good, but are based on knowledge, some understanding, and memorization. So now you're in a nursing program, and nursing exams differ greatly from the exams that you have been used to taking. Memorization alone will not get you through a nursing exam. Now, some memorization, such as memorizing certain lab values or memorizing formulas for calculating a medication dosage, may be necessary in nursing. However, the exam questions on a nursing exam are at a higher cognitive level than memorization, and you will be required to analyze, synthesize information, and apply it to a particular situation. You're not going to be able to rely only on pure knowledge, understanding, and memorization to answer test questions in a nursing exam. Instead, you need to understand pathophysiology related to certain nursing content and disease processes. You need to retrieve knowledge, analyze, synthesize, prioritize, and use critical thinking and application skills to answer nursing exam questions. Okay, so on this next slide, we're going to talk a little bit more about what to expect on nursing exams, and I'm going to turn this over to Angela.
Awesome, thank you. All right, so most questions that you'll encounter on nursing exams will be multiple choice questions, which consists of a question and 4 possible options. You're probably very familiar with these types of questions from your support or prerequisite courses. But again, what you need to remember is that nursing exam questions will require you to think critically. Other types of questions, known as alternate item formats, may also be included on nursing exams and standardized exams because these alternate types of questions are used on the NCLEX exam. There are various types of alternate item test questions, and we're going to demonstrate at the end of this evening session how you can locate these practice questions. You're also likely to see case studies with accompanying questions related to the case. These question types will prepare you to think like a nurse and will sharpen your clinical judgment skills. The total number of questions on your exam varies depending on various factors such as the instructor's preference, the amount of content being tested, the amount of time for testing, and so forth. Your nursing instructor determines the number of questions that will be included in an exam, and they'll share this information with you. And then moving on to the next slide, we'll talk about a few additional points about preparing for nursing exams, your course syllabus and your course objectives. The course syllabus is the map of your course, as Linda mentioned previously. It will provide you with your course objectives, course and program policies and procedures, required readings and other activities, and your course schedule, including the exam schedule, and then any other information specific to the course. Your course objectives are the goals that you need to meet in order to pass the course. So don't just gloss over that part. Make sure you read and understand them. In addition, your exam questions will directly reflect your course objectives. Your required reading and other activities in your class exam schedule are important to take note of because you need to plan ahead. You need to prepare ahead of time for these requirements. So be sure that you pay attention to what's stated in your course syllabus, all of those components that I touched on. The worst thing that you can do is put your class notes aside until it's time for an exam. As we've recommended, you need to read your class notes on a daily basis so that you're learning and understanding as the course progresses. You want to plan a time to have your own mini study sessions each day and read your notes. 1 week before an exam, you should spend more time in those mini study sessions so that you'll be ready. You don't want to cram exam content in your head only on the night before. You want to be doing a little bit at a time over a period of time. Practice questions. You want to practice as many study questions as you can in preparation for an exam. Remember that practice makes perfect, and simply knowing how the questions are structured and becoming familiar and comfortable with what you'll encounter will assist you in passing an exam. So you want to get your hands on as many study questions as possible because this will help you be successful not only on nursing exams, but also on the NCLEX when you are ready to take the NCLEX. Many nursing textbooks provide practice exam questions at the end of a chapter that goes over content. And they also will provide an electronic resource, probably like Evolve, for example, that contains practice exam questions. So be sure to look for these in your textbook and to practice answering these questions. And finally, use your NCLEX review book and review the content and practice questions that correlate with what you'll be tested on. And you should do this throughout the program, not just at the end when you're getting ready for NCLEX. Also, and very important, after you answer practice questions, be sure to read the accompanying rationale and test-taking strategies for each question to understand the content and the logical path for answering correctly. And we'll go over that at the end of the presentation as well. On the next slide, Linda is going to talk about test-taking strategies, and she'll illustrate some strategies and we'll do some practice questions.
Thank you, Angela. Well, test-taking strategies are really important skills And they're going to help you determine what a test question is asking and how to select the correct answer, or how to narrow your choices when you must make an educated guess at an answer. So using the test taking strategies is really pretty critical when taking a nursing exam, because in many of the exam questions, all options may be correct, but depending on the way the question is worded, you may need to prioritize to select the correct answer. And in addition, many times you may be able to narrow your choices down to 2 options, and then you may struggle with making a selection. So in these situations, the use of test-taking strategies is essential. Therefore, it's important for you to become skillful in the use of strategies. So we're going to talk about the fabulous 5 test-taking strategies. So on this next slide, we have strategy 1, which is the ingredients of the question. So always read every word in the question and pick out the parts or the ingredients. First, you will read information about the client. So think about the information. It'll be about the client situation or a clinical event, and try to visualize this in your head as you're reading the question. Then you will have your query, or sometimes called the stem of the question, which will ask you something about that client situation or event. So focus on what the question is asking you. Then you have your options or your choices to select from. Most questions and some questions will have 4 options, but there are going to be other questions that may have more than 4 options. So just read everything carefully. So now on this next slide, let's look at a practice question. The nurse, here's your event. The nurse is caring for a client who is receiving a medication that is a potassium retaining, also called sparing, diuretic. Your query or your stem, the nurse would monitor for which side effect of the medication. And here we have 4 options. 1, dry skin. 2, constipation. 3, hyperkalemia. And 4, hypernatremia. So let's see how you do with that question. You can select an answer in the polling system here. Okay, you actually did really well with this question. 89% of you selected hyperkalemia, which is the correct answer. So great work. Now this question is testing the clinical judgment skill, recognizing cues. And it's asking about a side effect of a potassium retaining diuretic. So now think about this and visualize what will happen if the medication is a potassium retaining one. What will happen to the potassium level in the body? It's going to go up. So now use retrieval knowledge and think about medical terminology and your A&P and biology courses. Remember that hyper means up or elevated, and then recall the abbreviation for potassium is K. So thus your answer is hyperkalemia. Great work on that. Okay, on this next slide, we have strategy number 2, which is avoid reading into question. So some tips for you is to read every single word in the question. We really want to emphasize that. And again, we emphasize visualizing the situation kind of in your head. So think about what the question is asking, and then look for strategic words, which we're going to talk about shortly. Think about the answer to the question before even looking at the options. Now, it may be there, but if it's not there, whatever you're thinking in your head, then the next best answer will be. So for example, a question reads that a client is having a hypoglycemic reaction and asks, which item will you give to the client? Now you may immediately think orange juice as the answer. And then you look down at the answers and orange juice is not there. So don't get alarmed if that happens, and look for the next best choice. And in this situation, It may be milk. Now, this question was actually on the NCLEX with milk being the answer. So your test questions do test you on concepts. And in this example, the concept was that you would provide the client having a hypoglycemic reaction with a 10 to 15 gram carbohydrate. So you would need to look for that food item in your options. Always reread your question and your options before selecting an answer. Always use the process of elimination with your options, and always avoid the what if syndrome. So what do we mean by the what if syndrome? Okay, so this means that you read a question and if you start asking yourself, well, what if this or what if that, then this is going to lead you down the wrong path for answering correctly. Focus on what is presented in the question and don't start thinking, well, what if this or what if that? Okay, we're going to go to the next slide and look at a practice question, and it illustrates how to avoid reading into the question. So I'll turn this over to Angela.
All right, so let's take a look at this question. I'll read it to you first. A client's abdominal dressing becomes wet while giving a bed bath. The nurse would take which action? 1, change the dressing. 2, let the dressing air dry. 3, leave the dressing alone. Or 4, call the client's physician. All right, very good. So 90% of the group chose the correct answer, which is option number 1. So if it's wet, you want to change it. But let me talk to you a little bit about how this question might lead a student to read into the question and then answer it incorrectly. So first of all, this question tests the clinical judgment skill take action because it's asking what you would do in this situation. In this particular question, you would use retrieval knowledge. So think about the concepts related to infection and the integumentary and immune systems from your anatomy and physiology and your biology courses. Remember that skin is your first line of defense against microorganisms. And if the client has a dressing, then there's a reason for it, and it's probably related to impaired skin integrity. Moisture is one factor that promotes the growth of bacteria, and so you wouldn't want to leave a wet dressing alone or allow it to air dry. You would want to change it. Now, for those of you that selected option 4, your thinking may have been that you need to get a doctor's order or a prescription to change a dressing. In the past, we've had students think that, well, in a post-op client, you'd need an order to change the first dressing. So what if it's a post-op client? I need to call first and find out if that's the case. What you don't want to do in that situation is read into the question like I just demonstrated. There's nothing in the question that says that this is a post-op client. And so if it's wet, change it and base your choice on all of the knowledge that you have about infection control. Another simple strategy that's pertinent here is eliminating comparable or alike or similar options. Note that options 2 and 3 are alike, and that if you leave the dressing alone, it will air dry. And so since there can only be one answer to a multiple choice question, you can use this strategy to eliminate those 2 options, leaving you down to the other 2 options. Okay, so strategy number 3, be on the lookout for strategic words. These are important words or phrases in a question or in the query of the question. You want to be on the lookout for these words, and remember that certain strategic words will indicate the need to prioritize. What this means is that all of the options may be correct and that you need to determine the best choice. And many of your questions will be prioritizing questions. We've listed some of the strategic words here on this slide. Immediately, initial, first, best, and priority indicate that all options will likely be correct, but that you need to place the items in the options in a priority order. Most likely or most appropriate The same with most likely or most appropriate. All of the options are correct, but which is most likely to occur, or which is your most appropriate action? Early or late? These are very important words to take note of. Early signs of shock are very different than the late signs of shock. So restless versus vital sign changes as an example. The need for further education and the need for follow-up. These phrases are negative event queries, and you need to be very careful with these. With these question types, you want to look for an incorrect client statement or an abnormal assessment finding as the answer to the question. And so it's something that's potentially incorrect or abnormal, that's the answer. On the day of and after several days. For example, it makes a difference as to what may be a normal finding on the day of surgery versus after several days following the surgery. For example, on the day of surgery following a prostate procedure, you would expect to see bloody urine in the client's urinary drainage bag. And so your action would likely be to continue to monitor that. But after several days following the surgery, let's say they've gone home and they call and tell you that they've been urinating blood, well, this would be unexpected and an action would need to be taken. On the next slide, we'll go over a practice question. Okay, so this one is related to being on the lookout for strategic words. The nurse is monitoring a post-operative client for signs of infection. Which is an early sign of infection? A low pulse rate, a low blood pressure, an elevated temperature, or separation of the incisional wound edges and a pus-like drainage. All right, so 84% of you chose option 3. So this question tests the clinical judgment skill recognizing cues. Your answer here is option number 3 because the question's asking about an early sign of infection. So what this should tell you is that there's going to be an answer here that's early while the others will probably be a later sign. So looking at option 4, it is a later sign. Elevated temperature would be early. A low blood pressure and pulse are unrelated to an early sign of infection. Use retrieval knowledge from anatomy and physiology and biology. Remember concepts of immune system and infection. This will help you to answer correctly. With changes in vital signs, that's usually a later sign of infection. Okay, and then Linda's going to go over strategy number 4, which goes over using prioritizing guidelines as a strategy.
Thank you, Angela. Okay, so our next strategy, using prioritizing guidelines, well, you can expect lots of prioritizing questions on your exams and of course also on the NCLEX. So using these guidelines are really important. And the 3 that we want to focus on are the ABCs, steps of the nursing process, and Maslow's hierarchy of needs theory. So on this next slide, let's just talk about the ABCs for a moment, which stands for airway, breathing, and circulation. So if you're asked about your first, initial, or immediate action, read everything carefully in the question and the options, and select the option that addresses airway. Now, one exception to this rule, however, is if the question asks about CPR or cardiopulmonary resuscitation, because in this case, you need to remember CAB. So circulation or compressions would be your priority, followed by airway and breathing. Okay, on this next slide, let's look at a practice question. So we have the nurse is caring for a client with pneumonia who suddenly experiences respiratory difficulty. The nurse would take which action first? 1, call the physician. 2, document the client's problem. 3, check the client's oxygen level by pulse oximetry. And 4, cover the client with a blanket and check the client's temperature. Well, you did great with that. 99% of you selected the correct option. So now this question actually tests the clinical judgment skill, take action, and note the strategic word first in that question. Now think like a nurse and determine what you would do. And if you use the ABCs, this is going to direct you to option 3. Now option 1 isn't the first action because you do need to collect more information. And option 2 is incorrect because the client's having respiratory difficulty. And although you do document the problem, you do need to do something about that respiratory difficulty. And option 4 actually is just unrelated to the client's problem altogether. So now on this next slide, we have the prioritizing guidelines, steps of the nursing process. And I'll turn this over to Angie.
All right, so you may or may not have learned about the nursing process at this point, but trust us when we say, if you haven't yet, you will learn about each of these steps. So the steps are assessment, analysis, planning, implementation, and evaluation. So when asked about the immediate, initial, or first nursing action, you want to select the option that is an assessment action. If assessment option is not addressed in one of the options, then from there, follow the steps of the nursing process. One exception to this guideline is in emergency situations. In an emergency situation, you may need to take an action rather than perform an assessment. So for example, if a client develops a condition known as pulmonary edema, which is too much fluid collecting in the lungs, and which usually occurs in a client who has heart failure, you'll need to take an action first, such as getting the head of the bed elevated before you would do an assessment, such as obtaining vital signs or listening to lung sounds. On the next slide, we have a practice question that illustrates this a bit further. The nurse enters a client's room and finds the client slumped down in the chair. Breathing is shallow and a pulse is present. Based on this data, which is the priority action? 1, call the physician. 2, have the unit secretary call a code blue. 3, ask the unit secretary to call the family. Or 4, check the blood pressure and level of consciousness. All right, excellent. So it looks like 89% of the group chose option 4. So this question, it tests the clinical judgment skill, take action. What you want to do is focus on the data in the question. Note that the client has a pulse and they're breathing. And so there's no reason to call a code, and it's premature at this point to call the family. It also is premature to call the physician because the nurse needs to assess and gather more data before calling. So that's another thing to keep in mind, is that if there's an option that says to call the physician, it probably wouldn't be the first action, especially if there is another option that speaks to collecting further information that would be pertinent to the situation. On the next slide, we'll talk about another prioritizing guideline, which is Maslow's hierarchy of needs theory. So what Maslow's theory says is that physiological needs come first. You want to use this as a guideline and select an option that addresses a physiological need. If a physiological need is not addressed in the question or the options, then think about the hierarchy. Safety needs should receive the priority next. So remember, address physiological needs first. On the next slide, Linda's going to go over a practice question that relates to this theory.
Thank you, Angela. The nurse creates a plan of care for a client with sickle cell anemia. Which problem would the nurse select as a priority? Now, you may say to yourself, I don't know anything about sickle cell anemia. Well, don't worry, because if you use Maslow's hierarchy, you can answer this question without even knowing about sickle cell anemia. So let's look at our options. Option 1 is anxiety. Option 2 is ineffective coping. Option 3, deficient fluid volume. And 4, disturbed body image. So let's see what you do with that. Okay, great work. 80% of you selected option 3, which is definitely the correct answer. So note your word priority in this question. And if you use Maslow's theory, option 3 is the only correct answer because it's the only option that addresses a physiological need. The other options address psychosocial needs. So remember, physiological needs are the priority according to Maslow. Okay, on this next slide, we have strategy number 5, which is using therapeutic communication techniques. So what guidelines can you use? Well, you're going to be learning a lot about therapeutic communication throughout all of your nursing courses. And there are some primary guidelines to follow to help you with answering communication questions. Remember that therapeutic communication techniques are the ones that are effective in the communication process, whereas the non-therapeutic communication techniques are very ineffective. Another strategy is to always focus on the client's feelings, their concerns, their anxieties, or their fears. And that's another great strategy to use. And the last here, you would not tell the client not to worry. You would not place the client's feelings on hold. You would always address their feelings. You would not provide false reassurance, and you would not ask the client why. So let's move to the next slide and look at a practice question here. A mother says to the nurse in the doctor's office, "I am afraid that my child might have another seizure." Which response by the nurse is therapeutic? 1, tell me what frightens you the most about seizures. 2, why worry about something that you cannot control? 3, most children will never experience a second seizure. And 4, the anti-seizure medication can prevent another seizure from occurring. So let's see what you do. Okay, well, 95% of you selected the correct option. In this question, you're going to use therapeutic communication techniques, and option 1 is the only one that addresses the client's fears. Now, option 2 is non-therapeutic because it states that the mother should not worry, and it uses the word why. And option 3 and 4 are incorrect because the nurse is giving false reassurance to the mother that a seizure will not recur or that a seizure can be prevented in this child. Okay, so we have another question on this next slide, and I'll turn it over to Angela.
Perfect, thank you. I believe this might be our last question that we're going to go over with you all. So let's take a look at this one. This one also relates to therapeutic communication techniques. A client recently diagnosed with ovarian cancer says to the nurse, "I can't believe this happened to me. I wish that I were dead." Which response is therapeutic? 1, every client diagnosed with this type of cancer says the same thing. 2, you must be feeling very upset. Are you thinking of hurting yourself? 3, I know what you mean. There are a lot of treatments available for ovarian cancer. And 4, why are you talking that way? Your children would not want to hear you say that, would they? All right, so 93% of the group chose option 2. So let's take a closer look at this. Using therapeutic communication techniques, looking at option 2, the nurse focuses on the client's statement, addresses their feelings and their response. In options 1 and 3, the nurse actually is minimizing their feelings. In option 3, also, there's false reassurance there as well. And then option 4, the nurse uses the word why, which implies criticism, and it often makes clients feel defensive. Additionally, option 4 focuses on the client's children and not specifically on the client. All right, so moving forward, we want to show you the table of contents for our Strategies for Test Success book. Most of you have this book, or you may be receiving this book as one of your required books as you start your nursing program. So we want to point out that We shared some key points with you this evening regarding preparing for your nursing exams, as well as some test taking strategies. But this book, as you can see from the table of contents listing that there are many strategies that you can learn to use for your nursing exams. We do also want to point out that the book is accompanied by the Evolve site that has 1,200 practice questions. So if you look here, you can see the various chapters contained within this book. And so there's a lot more in the way of strategies that you can learn from. And then moving forward, Linda's going to talk a little bit more about these resources.
Okay, I'm just going to briefly go over these because I know we're a little over time, and we thank all of you for taking the time this evening to spend with us to learn how to get ready for the exams. But these are some great resources that are going to be really helpful while you're in nursing school and preparing for your nursing exams and in preparation for the NCLEX. So we've already talked about the Strategies for Test Success book, and that is a fantastic book to help you with answering questions if you're having difficulty with that. And then we have the Comprehensive Review book for the RN and the PN just below it. And these books are great while you're in nursing school to get ready for your exams, and also at the same time, they prepare you for the NCLEX. And then we have the RN and the PN Q&A books. And the difference with this is that these books have only practice questions that are at a higher level than those in the Comprehensive Review book. But the questions in the Q&A books are completely different from the ones in the Comprehensive Reviews. So students also love this book because of the health problem aspect that we're going to show you in the Comp Review. And then we have online review courses that model the NCLEX test plan and really help put those finishing touches on when you're getting ready for that NCLEX examination. And finally, Angela's going to share her screen and illustrate how to best use the Evolve site that accompanies the Comprehensive Review books, both RN and PN. Most of you have these books, and we just want to illustrate how to best use that Evolve site to find the practice questions that address the nursing content you're learning. Okay, so I'm going to turn this over to Angela.
Excellent, thank you so much. And thank you for everybody for staying on. First, what I have here pulled up is our comp review for the NCLEX RN, but we do also have the comprehensive review for the NCLEX PN for our LPN students out there. And the process that I'm going to show you looks exactly the same for the PN as well. So the first thing that I want to show you, which I think is really will be helpful to you in preparing for especially those early nursing courses, will be for you to access the Evolve site that accompanies the book. You'll have that information in the preface of your textbook. If you go on here and you click study mode under step 1, this will give you immediate instant feedback after you answer questions. And then you would click in step 2, content area. And sometimes this new questions only will be turned on. You can leave that turned on if you only want to do new questions, or you can turn it off if you want all questions that pertain to the area that you're studying for. So now in step 3, if you want to study, let's say for your Foundations of Care or your Fundamentals of Nursing course, I'm going to do the drop-down menu here. You can see the different areas that will likely line up with the content that you're studying in that course. So for example, if you have an exam on acid-base and fluid and electrolytes, there's 129 questions that you can look at that pertain specifically to that. And so then looking here, here's the question. You can read through the question. You can pick an option. I'm just going to pick any option. Click submit. It will show you what the correct answer is. And then over here, you can click rationale. This is the part that for sure you want to read through this part. This goes over the different coding that we use to make sure that we're covering everything that we need to with the questions that we have. And then the strategy is also another thing. This is the logical path that you can use to answer a question. And so it will point out any strategies that may be useful for you in answering a question. And then here is the reference source if you'd like to know where we got this information from that informs this question. And then this tab may be helpful to you as you're studying, the labs tab. It will pull up a document that has common laboratory reference intervals. So if you're answering a question on labs and you're like, oh, you know, I don't remember what the normal bilirubin level is, you can come here and you can look and you can see what it might be. Just take note that there may be slight variations in what's considered to be normal based on what resource you're looking at. That's because not every piece of equipment in every lab is calibrated exactly the same, but if the question is trying to get at the concept of an abnormal lab, it will be grossly abnormal or clearly abnormal. It wouldn't be slightly abnormal. So if you do see some slight differences, that's expected and that's the reason why. So that's one thing that we wanted to show you. And the other thing that I wanted to show you that may be helpful for you in the beginning is to, and also you can do exam mode, which will give you the question one right after the other, and it will give the feedback after you take either a 10, 25, 50, or 100 question exam. So now another area that may be helpful to you early on would be study mode content area. Let's go here. Pharmacology. You might be taking pharmacology early on in the semester. So it will do a drop down by body system, but then also by drug classification as well. So for example, antidysrhythmics, antihypertensives, and then let's say ACE inhibitors, anticoagulants. You can get questions that are specific to the drug class, which has been very helpful to our students. So I wanted to show that one to you as well.
Angela, I'd love to hop in. We actually got a question from a student that I'd love for you to demonstrate here. They said, I heard a lot about med-surg nursing and I hear there is so much that we need to learn. What is the best way to study for these med-surg courses?
Oh, that's a really good question. And yes, I definitely would have something to share here in this platform specific to that. There's a ton of information on med-surg. It's going to be one or maybe two of your nursing courses in your program. And it is the biggest area on your NCLEX exam. So you want to be very, very familiar with med-surg concepts. So if you go here to study mode and then to health problem, this is one way that Linda and I tried to kind of redesign this product to allow students to be able to find questions, not just by cardiovascular, but also by the health problem itself or the condition. And so if you go to health problem, drop down further, and let's say you're working on heart failure and dysrhythmias, you can do 133 practice questions that are specific to that problem, because not every condition under cardiovascular will be tested. And so this is just another way for you to study a little bit smarter and a little bit more deliberately and directly. So that is one way that I think would be very helpful to address med-surg content.
Thank you all so much for sending in so many great questions today. I know we're running a little bit over, but we'd still love to take some time to answer some questions and hopefully wrap up at 8:30. So I wanted to start off by asking you, Linda and Angela, how many students would you recommend to have in a study group?
Okay, do you want me to start, Angela, and then you can add to it?
Sure.
Okay, I think that's a great question. And, you know, it will vary, but the size of the study group should be somewhere between 3 and 5. And some other really important points to remember is that every group member needs to come to the study time prepared to participate. So when the study group is initially created, group goals, expectations should be developed, and then the group needs to work to achieve those goals that were designed or developed for the group. Everyone in the group needs to take on a specific task and provide a contribution to the study group when you get together and work together. Remember that study groups are made up of individuals, and each individual is a part of the team. So if a team member contributes to the study session as planned, then the team will definitely be successful. Anything to add, Angela?
I think that was a really good summary. Maybe at this time, you might have questions about if you did want to form a study group, how would you go about that right now? I know there are some schools that have their libraries open. I think there's some public libraries open, but it may be beneficial to consider using a web conferencing platform that you have access to, Google Hangouts, Zoom, something like that. You can share screens, you can share documents. I would also recommend with a study group that, as Linda mentioned, having tasks delegated and then having each group member come prepared with something written as well that can be referred to at a later point in time, rather than just a discussion alone, because that will then help you to be able to review on an ongoing basis.
Awesome. Thank you both so much. We've had a lot of questions coming in regarding digital learning now that a lot of students have been switched to digital classes. Is there anything that students should do differently with exam preparation and managing those online courses?
Sure. I'll go ahead and start with that one, Linda. If you have anything to add, please just jump in at any time. I think with exam preparation, aside from what I showed you already with doing practice questions, there's not a whole lot I would say that would be different with preparing for exams, but maybe just a few considerations. Since a lot of classes are operating completely online right now, it's really important to engage in any live sessions if you're able to do that, rather than listening to a recording later. It's understandable if that's not always possible, but it's really, really helpful to have that live interaction with your peers and with your instructor. I would be very proactive with asking questions since you don't actually get to see your instructor as often. So still try to maintain contact whenever possible with your instructor. That will be really helpful. Every state and every school is different in terms of their restrictions and requirements and regulations right now. So just don't hesitate to ask questions from your program leaders, from your instructors, and to reach out if you have any concerns with preparing and with going through school right now. Clinical opportunities may be a bit more limited right now due to the pandemic. And so clinical often does help to prepare for exams as well. And so I would recommend augmenting those potentially missed in-person clinical opportunities with whatever resources are being required in place of clinical, as well as doing more practice questions. Practice questions really help, as we mentioned, to develop that clinical judgment and the decision making. And so this will help with those missed clinical opportunities and will help to prepare you for exams. Another thing I would do is review previous exams with your instructors to learn about the mistakes that you made, so that you don't continue to make those mistakes in the future, and kind of go through the exam and think to yourself what may have contributed to not answering a question correctly. Was it a content gap or a knowledge gap? Was it misreading the question, reading the question too fast? Could you have applied a strategy in that situation? Could you have thought about it a little bit differently? That exercise is really, really important to help preventing mistakes on future exams. Linda, is there anything else you'd like to add to that?
No, I think you did an excellent job answering that question. It was very clear and very thorough and comprehensive. So great suggestions for the students.
Thank you.
Yeah, thank you, Angela. That hit on a lot of the questions that have been coming in. Just piggybacking off of that, a lot of students have been asking exactly how many NCLEX-prep questions or practice questions they should be doing each day. Is there a specific number that you recommend, or is this different for each student? What would you suggest?
Well, I would say that it all depends. If you're in nursing school and you're trying to, manage courses and all of the course readings and for the several courses that you might be taking, I would, and Angela, you can jump in at any time, I would suggest you don't want to overwhelm yourself. So if you're in nursing school and you're moving along, you may want to do 25 a day. Every single day, and that will help build your knowledge base and your understanding and being able to apply things when you're reading questions. Now, if you're in your senior year, you want to pick up the pace a little bit, because before you go in to take that NCLEX exam, you will have wanted to practice at least 3,500 to 4,000 questions before going into that exam. And Angela, do you want to add to that at all?
I'll just add a couple little tidbits to that. I would just keep in mind that doing practice questions and answering exam questions, especially nursing exam questions, it really is a skill, as we talked about this evening. And so don't let yourself become discouraged, especially in the beginning, if you're answering questions and you're not getting them right. It's a skill that develops over time, and you'll notice over time that you're improving on that. But the best thing that you can do to get ready for your exams and ultimately for the NCLEX is to continue to practice questions and really identify the areas that you're struggling with. And it's not only the rationales, but also those test taking strategies that will really make a difference with that. I agree with, about 25 questions a day that are clearly related to the content that you're learning is going to be the best thing. Definitely go with whatever product is required for your course. That's going to be the most directly related to what you're learning at the time. And as far as any supplementary material, definitely having an NCLEX review book that you're using from the very beginning of the program, and accessing the questions that are specifically related to the course that you're studying is going to be the most helpful.
That's fantastic advice. Thank you so much, Linda and Angela. I think that's a great place to wrap up there. I want to thank everyone so much for joining our webinar this evening. Linda and Angela, any last notes to the students that have joined us?
Just stay positive and believe in yourself, as we see on the screen here. Just, work hard. You can be successful, and, nothing can stop you. So we wish you the best success. And Angela, anything to add?
Just thank you so much for your time. And I think this was an excellent way for you all to get started with school, and hopefully you found this helpful, and it was good timing for you as you're getting ready to start your program. So best of luck to you, and you've chosen a great profession.